My name's Olivia Moistner, and I'm a PCI on 4 North. I'm also a PCI in the ER here at Methodist. At nursing school, they recommend after your first round of clinicals, you typically get a job as a patient care assistant for an inpatient unit. You get report on your patients, you learn about them. You want to know their diet, their mobility, and then how often to get their vital signs. Do we need to check their blood sugar? And then you want to give them a nice bath every day, change their sheets, make them feel like they're a person. It was an email that rolled out from our manager, and it was this patient care intern, a program for nursing students. This is a new program. This helps us get out there, and it helps us see the real world before we're actually in it. It kind of helps you transition into that job of being a nurse. You can shadow people in the hospital, doctors, nurse practitioners, physician assistants, social work, chaplain, and those are paid shadows that you get to go to, and that's not something that other people get the opportunity to do. In nursing school, it's you have the perfect patient. They've got perfect skin, they don't have any broken limbs, they really don't even need to be at the hospital, but that's what you work with. But here it's traumatic injuries, especially the brain injuries, those cause all kind of behavioral issues that need to be dealt with. I had a patient that I went into the room. I had him the day before. He was alert and we talked, and it didn't make a whole lot of sense because they had a traumatic brain injury and they had a bone flap out, but they ended up having a change in level of consciousness the next day. They weren't wanting to wake up easily. They weren't wanting to respond to stimulation, stuff like that. I actually pulled our educator, Gabby, in the room because that was the first nurse I could find in the hallway. And I was like, hey, can you come take a look at my patient? I'm just a little worried, change from yesterday. And then he ended up going to the ICU because it was a change, and that can be really dangerous for them. So it was a really good catch, and I hope they're okay wherever they are now. I feel confident when I come in that my patients, they're going to be taken care of, because I'm going to do what I can in my role and my scope of practice to make sure that they know that they're not just a number to me, that they're actually my patient and I do care for them.